But what we're also finding is because we've never had a treatment that helps you lose this much weight so effectively, there are considerations that we've never had to have that we now have to have. So we're now finding that because they're losing weight so quickly, they're actually losing muscle mass.
Yeah.
And we've never had a treatment that is so effective that you're losing weight too quickly. And what I think will need to happen very soon is there will almost need to be a expected projection of weight loss to say this is how quickly you should be losing weight. And if it's more than this, stop the medication or drop the dose. Because people, when you lose weight too quickly, you burn through your carbohydrates, you burn through your fat, and what's next?
Your muscles, isn't it?
Your muscle, right? So people are losing so much weight, and because they're not eating anything, because it's restricting their appetite, they're not keeping up their protein content. People are going a day or two without eating sometimes, almost facilitated fasting, right? And so they're losing muscle mass. And what people are unaware of is when you lose muscle mass and you're relatively young, you speed up the decline of your bones. So your bones are only healthy because you're putting weight on them and because you're using them and there's muscle attached to them. When you're losing a lot of this weight, your risk of osteoporosis and brittle bones significantly increases. So I'm really worried in the next 10 years about what's going to happen to our osteoporosis rates, what's going to happen to bone density, how easily people are going to fracture their bones. And obviously, if your bone mineral density is really, really reduced, even the corrective measures like surgery are less successful because the stuff you're going to drill into isn't going to be good. It's not going to be good quality, right?
Yeah.
We don't have any infrastructure around if these people are having this treatment, checking their bone quality, doing DEXA scans, starting them on bone strengthening treatments. So if you've got somebody with, so let's not take the extreme, let's take a normal example or an intended use case example. You have a person with diabetes who's significantly overweight. They appropriately qualify for the treatment and they've started the treatment. Great. Because they have diabetes and you want to keep the weight off, they're probably going to continue with this treatment for life, in all honesty, right? And we'll come back to that because that's important. So they're going to carry on with the treatment for life. They've lost their weight, the diabetes is well controlled and they can't come off the treatment. Great. But what we don't then have is when do we stop or when do we reduce? How do we monitor that? And how much weight should they be losing and why?